A 68-year-old lady with lifelong leg swelling, only to have it get worse in her 50s and 60s after undergoing a hysterectomy. Now she has severe swelling and leg pain bilaterally, taking a high dose of a diuretic with no results. However, she made these changes to get improvement for the first time in her life. Welcome to Montgomery Heart Wellness, and we have another exciting clinical case rounds with you here on Clinical Rounds. And today we're going to talk about a lady who is 68 years old with lifelong leg swelling.
Yes, so she reported swelling in her legs since a child, maybe around the age of 10. And not until she was an older adult did it start to cause aching, discomfort. Made worse after she's gotten some surgeries like a hysterectomy, lipoma removal, and spinal surgery. And we know surgeries can be a risk factor for lymphedema because sometimes those lymphatic structures can get damaged. And she worked as a dentist, so she's on her feet all day. And, that can also worsen those symptoms. So it's at a point where the pain and the aching and heaviness, those thoughts were permeating her mind during her job.
So, we know that swelling typically can be caused by any one of a number of things: blood clots, excess fluid retention due to, vein disease, so venous insufficiency. So these are circulatory issues. Oftentimes, there's another condition we don't think about a lot, which is lymphatic drainage problems. Mm-hmm. And I think that was the impression here.
Right. So she never had anyone really discuss that with her, and when she went to her primary care, she was prescribed a diuretic called furosemide, and she took that, but she did her research and knew that that wouldn't be ideal to stay on long term due to potential adverse effects of throwing off your electrolytes, and that alone can cause a lot of different cardiac issues, but also it could harm the kidneys if overused long term.
I want to share with the audience that oftentimes medical professionals, when they see something like swelling, the knee-jerk reaction is to prescribe a diuretic. Swelling, fluid, diuretic. But it's not that simple because, the diuretic, particularly the one she was on, was furosemide. It actually poisons the kidney to force the kidney to waste more urine out distally. So it really dries you out. But it doesn't necessarily treat the swelling because the mechanism of swelling isn't the fact that there's too much volume inside the blood vessels, which is where the kidney affects, but it's lots of leakage of fluid outside the blood vessels, outside the cells. And oftentimes that fluid is there because of local inflammation, oxidative stress. There can be proteins and different waste material that's in the interstitial space that the body's trying to keep away from central circulation. So that swelling often will not respond to a diuretic. And many of you may have loved ones with swelling, etc. They may be on diuretics. Maybe you get a little bit of improvement. But if that swelling is not due to total volume overload and it's due to local inflammation, then you're not going to get very much effect from a diuretic. In fact, the diuretic is going to make things worse. It's going to make you more dehydrated. A dehydrated body is a body that's more toxic because you're not going to flush toxins out. If you're dehydrated, your bowels don't work very well. You're dehydrated, you don't flush your kidneys, so you don't flush toxins through the kidney very well. So you actually, paradoxically, build up more toxins, and you probably make the swelling, to some extent, worse. So what did you do with her?
She already knew about the raw detox because her sibling was a patient, so she was ready to start that, and we put her on raw detox with intermittent fasting as well. And she did most of it on her own, following our guidelines 100%. And she noticed quickly, her legs were less painful. And I told her that's a sign of less inflammation going on. Like, the process is changing here. And so I was able to convince her to reduce the furosemide because she was very hesitant. And we reduced it to half the dose, and she was still noticing improvement in the heaviness, the leg pain. Her legs were less swollen. She was having better work days because of that. So that was really good for her.
Yeah. And the nutritional component, again, this nutritional intervention, reduction in inflammation, reduction of oxidative stress. So immediately, even though she was still on the diuretic, she got relief not from the diuretic, but from the nutritional intervention. And as we talked about earlier, removing the toxin, reducing inflammation, that reduces the swelling and reduces the symptom related to it. And so even though you came down and eventually off the diuretics, the swelling continued to get less. So there you have it. I hope you picked up on this conversation that is really the mechanism of disease. Helping people improve their health has a lot to do with helping them, allowing their bodies to heal itself. And so a big component is going to be to get to some of the basic things: hydration, optimal nutrition, and removing inflammation, removing oxidative stress. So that was the case here, a very simple, straightforward case. The lady had a long-standing problem, but we hope that she continues to improve. So as always, have any questions or comments, leave them in the comment box. Until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.